I can always tell someone has a bad hip without an x-ray, without talking to them, if I can just see their hip move. My patients, all of them, all the time, every operation, are allowed to do everything that they want. I'll tailor the operation to make sure that happens. We make an incision and we take the hip completely out of joint. Once we get it apart, we remove the ball on a typical hip replacement. Just take a saw and cut across the bone in the appropriate area, remove the ball. Then we work on the socket part of the hip. We put a new surface to replace the worn down cartilage that we have. And then after that, we turn to replacing the ball itself. The common ones over and over would be basically infection. A blood clot can occur, or some goal not met as far as the functional outcome. For a patient, though, they have to be comfortable that they've been heard, so that their symptoms have been listened to and the operation is matched to them. Not to someone else, but to them. You've got to get the joint surface correctly and fully restored. You have to get the length and leverage of the muscles around the hip correctly adjusted. They can't be off a little bit. And that's not just leg length. It's a thing called offset, too, that has to do with how far away the center of movement is from the center of your pelvis. Metal we know a lot about. It's plenty smooth and it will never break. Ceramic's smoother is why you would offer it to a patient. It has better frictional characteristics. I've tried hard to break some of the new ceramic balls, and I haven't figured out a way to do so yet. No, nothing. Not a scratch, not a crack, no marks at all. And that's after being used, hit with a hammer, dropped out of a second story or so window, now run over a few times with a car. Nothing. The majority of patients, it'll last them the rest of their life, no matter what they do.